Welcome back to Champions of Care. Today we're talking about breast cancer. And in this segment of our show, we're going to talk about surgical treatment options. We're very fortunate to have in our studio today Dr. Madj Aburabia, who is a board-certified breast surgeon. Welcome to Champions of Care, Dr. Aburabia.
Thank you. Thanks for having me.
We're so happy to have you.
I appreciate
Now,
it.
when you're brought in to consult with a patient who maybe appears to have breast cancer, what happens? How does that go?
Well, usually I meet the patient every patient is different. Some patients I meet with them after they've just had a needle biopsy that showed breast cancer, and they want to see a surgeon to talk about their surgical options. Sometimes I see a patient because she just had a mammogram or an ultrasound and it showed something suspicious or something abnormal. Sometimes they see me because they have a family history of breast cancer and want somebody to follow them more closely, or if they feel a lump or something like that in their breast and want it evaluated. So every patient is different.
Now, I heard you say they want to understand their options. What are their options? How many different options does a woman who might possibly have a cancerous tumor really have?
Actually, breast cancer is one of those where most women have options for treatment as far as surgery is concerned. There are mainly two main options. One is called mastectomy, that is removing the breast, and one is called breast conservation, which means lumpectomy or partial mastectomy. It's the same thing, followed by radiation. Now, every woman, its case is different. Some women have that option and some women don't, but most do have an option to choose between the two things. Things that make a difference on whether a woman can have breast conservation include the size of the tumor versus the size of the breast. So if a woman has a small enough tumor that you could remove with a lumpectomy and leave the rest of the breast intact, she has that option. So we can remove the lump of the cancer, remove a normal margin around it, that's a rim of normal tissue around it, and leave the rest of the breast intact in a shape that she would be happy with. And most women have that option and choose to have that option. Part of the deal with having breast conservation is to have radiation. Mm-hmm. The other option is a mastectomy. That is removing all of the breast tissue, removing the nipple, and I usually work with a plastic surgeon who would reconstruct the breast. Mm. In order for a woman to qualify for breast conservation, the size of the tumor has to be small enough in relation to the rest of the breast, has to be confined to one quadrant of the breast. If the woman has a small breast and a large tumor, unfortunately, most of the time we cannot do a lumpectomy on her. But if the tumor size is small and there is enough normal tissue of the breast tissue, she can have that option.
So as a skilled, board-certified breast surgeon, your job is to get the cancer out and to work with the patient about her options.
Correct.
Excuse me. Now, how do you work with a plastic surgeon or who comes in to regain the shape of that woman's breast?
Well, and that's a good question for women to know, that they have that option of reconstruction. Let's say a woman has to have a mastectomy because of the size of the tumor or how advanced it is, or because she wants to have a mastectomy, that's her choice, or she cannot have radiation for whatever reason. Then the treatment would be a mastectomy. I usually set up the patient to see a plastic surgeon before surgery. So she gets that consultation prior to her surgery. She learns about the different types of reconstruction. There's another area where she has options, different kinds of reconstruction. And then if she agrees to proceed with that, if that's what she wants, then we schedule the surgery to be done at the same time.
At the same time?
Correct.
Oh.
I do the mastectomy, and while she's still asleep, the plastic surgeon starts the reconstruction process at the same operation.
Wow, well that must be very comforting to know that by working with a breast surgeon, a woman can move down that continuum, more quickly. They get the cancer out and start to reconstruct the breast tissue.
Correct, and I always emphasize to patients that they need to understand that the reconstruction is not considered a cosmetic procedure. This is a reconstructive procedure. This is not about vanity. It's about, physical capabilities. It's about that she would be even, that she wouldn't have back pain because she is breast on one side and not another. And some women feel timid about requesting reconstruction, but I always like to reassure them that don't be timid. And even if you've had a mastectomy years ago and did not get reconstruction at this time, you still have that option. It's never too late.
That must be very comforting to have your counsel. Dr. Aburabia, what is success in breast cancer surgery? How is that defined?
It's very difficult to say what exactly constitutes success for every woman. It's also involved a woman's goal. It would be wonderful when the day comes when we can identify the causes that lead to breast cancer and are able to prevent it. That would be the ultimate success. So we can prevent it before it occurs. But until that happens, we'd be happy with being able to catch the cancer as quickly as possible with minimal changes or minimal invasive procedures for the patient to treat it and get rid of it and keep the woman cancer-free and live a normal life after that.
Dr. Aburabia, I want to thank you for being with us today and bringing your expertise to Champions of Care as a fellowship-trained breast surgeon. We're so pleased to have you. And to our viewers today, as our program has clearly stated, there's no shortcut to early detection. And even though you may not have a family health history of breast cancer, come in for that mammogram, do those monthly breast self-exams, because early detection is your best defense in this war on breast cancer. You've been watching Champions of Care today. My name is Mary Zatina. Please go to oakwood.org for more information about Oakwood, and also for our panel of expert physicians who are with us today, Dr. Julie Zengerhain, Dr. Sophia Romanis, and Dr. Madj Aburabia. Thank you for tuning in.